Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Now, a really interesting guest, Dr. MICHANNE Davidson, who is an audiologist and owner of Active Like Hearing. So welcome to our show, MICHANNE.
Thank you very much. Glad to be here. Can you hear me? Is my mic closed?
Yeah,
Hello.
No, you're fine.
Okay.
Okay, so you had a very, very interesting weekend. What did you do?
I
not
did.
Over yet, but
yeah, right. Right. It feels like for me, I was up in New Jersey at a conference, a hearing aid conference at a manufacturer's facility, which was wonderful. It's a behind-the-scenes look at how hearing aids are not only manufactured, but the research and development involved, and then of course how they're manufactured from start to finish, and then learning some of the business side of it. It was wonderful, and I got a little hint of new things coming down the pipeline, so that was good.
Well, I'm glad that you're talking about this because, unfortunately, too many people, look at hearing aids like some new dishes or something that they're going to just be able to wash and eat on, and they don't understand that it's almost like getting an implant.
Exactly. There is quite a bit of fine-tuning that has to be done to make sure we meet all of the needs that the patient has. And that's really one of the most important parts, I think, of when I meet a patient is before we ever put them in a soundproof room and do testing, we really have to find out what their difficulties are. And it could be something from I can't hear my doorbell to my husband has lost some of his voice and I can't hear him when he calls me. Or it could be, gosh, I go out with my friends for dinner and all I can do is shake my head and smile because I have no idea what they're saying. So, we really have to look at their entire life and try to figure out, the different technologies available to correct these issues. And sometimes it's more than just hearing aids. So.
Yeah, that's true. And one thing that I've noticed is I go to the theater with a friend and sometimes she'll say, can I switch seats with you? Because when you talk to me, I have a better ear. And I said, so why don't you go get your ears? Oh, no.
Right.
A lot of the women in their 60s,
right, they
can't figure out that they need a hearing aid because years ago, hearing aids, of course, were very visible. And even at that point, I still think it was important. But they don't want to show anything. And so why don't you take that on as a conversation?
Right. Well, it's very interesting that you told me that story because the day before I left for my conference, it was a late appointment, maybe 4:00. And I thought, I'll be done by 5. And this cute couple came in, and it was a very concerned husband with a very soft voice like this, and his wife, and he brought her in, and she said, I cannot hear my husband's voice anymore at all. I can't hear him speaking.
And she blamed him because his voice was so soft, right?
Right, correct. And I said, well, I had asked her a couple questions, and she didn't hear my questions, which is unusual when you're sitting fairly close. So I thought, okay, we're going to be here late tonight. I can tell right away, within the first question. So sure enough, she had a severe untreated hearing loss. You don't get that many cases of that where someone has never worn hearing aids and they're at the severe point. Usually you get them in the mild to moderate stage in the beginning. So I was a little bit thinking, okay, we have a lot to do here. And what happens is it's really auditory deprivation. So imagine living your life in a soundproof chamber. And then when you put hearing aids in, it's like walking out of a soundproof chamber onto Fifth Avenue in New York. Okay, it's a very drastic difference. So I put them on her, and, I have demo sets. So I like patients to borrow instruments to wear for, a week at home because I really feel they need to experience what it's like to have hearing, in their everyday life. So I put them on her to send her home, and she actually rejected the sound. She was like, I can't stand the sound of my voice. I this and that. And I said, okay, I had to go into then really an explanation as to what was happening in her brain, that her brain was so used to this silence. She had been living in a bubble for probably 10 years, a bubble of silence that we have just had to break through. So, after that amount of time, we realized that, we're going to have to take it very, very slowly, where we're just giving her a small amount of amplification. We couldn't get anywhere near her prescriptive level. And we're going to have to just slowly wean her into accepting sound again into her life. There's no other way to do it. But
this is why
crazy.
I respect you so much. I couldn't be having this conversation with too many people. I mean, hearing specialists, they're well trained in some, they're caring many times, but that's not what they would do. They would say, well, this is what it is, and you'll just have to get used to it. But you come with a medical degree in the sense, and you understand this, and that's why you are so perfect for our listeners and our readers. That was really beautifully said. So, but what happened to her husband in the meantime? Did he need anything?
Well, I don't know yet. we spent 2 hours with her, and we'll see. He'll be our next.
But that was the reason, in
patient.
the sense that she thought that he talks too low or something.
Correct. And and I said, well, but I can hear him just fine, and I'm the same distance away, and so there's more to the story. And I think she was shocked to see it had progressed to that degree, because as I tried to explain to her, hearing loss, we only lose about 0.5% a year, typically in most cases. So it's very difficult to track that if it's coming on so gradually. It's like gray hair. You have one, and then you might not see another one for a few months or a year, and before you know it, you look in there, it's like, oh, time for a dye job. So
but
it's like that with hearing.
Hearing, does everybody lose some part of hearing?
Believe it or not, research has shown that we all lose about 0.5% a year from the day we're born. And it's not necessarily hearing, it's nerve cells. We have nerve cells in our ear that we're born with lots of extra ones. And we lose them at the rate of about 0.5% a year. So the more new nerve cells we lose, at some point it shows up on a hearing test as a hearing loss. It doesn't show up till you reach about 30%. So 30% is what? Half of 60. 30 is half of 60. So about the age of 60, you should be able to detect hearing loss on an audiogram when evaluating patients.
That's a lot of news that you've just told us. Maybe in your next article you ought to be saying some of these things so people can understand it's not that they have, cancer. I mean, right. that everybody doesn't get cancer. Right. But everybody has a certain amount of hearing loss, and that's, correct. I didn't even know that.
Correct.
So let's say someone comes in and they have that 30%. That would mean that maybe they're just going to watch or you're going to give them a hearing aid that's very minimal. How do you do this?
Well, that's very interesting. In the past, I've been an audiologist for over 25 years. I should say over 30, but then the people will know how old I am. So in the past, we wouldn't touch patients with 30% loss. Because there wasn't the technology available to just attack that small amount of hearing loss. It would be overkill. Nowadays, obviously, everything is computer chip driven, so we can pinpoint the exact frequencies, the beginning frequencies where the loss is present, and just correct those and not bother the area of normal hearing, where that wasn't available many years ago. So we can actually correct 30% losses. But then we have the question of what is the patient's needs. So we really have to evaluate the patient. What difficulty are they having? My husband's a perfect example. We caught him in his 40s of hearing loss because his needs were very great. He was a working professional, had to attend conferences and meetings. 30% for him had a huge impact on his career, his work life. 30% for someone that is retired or, has really doesn't have the needs for close
right.
contact, that person might wait. And so it's not just the test. We have to do a lifestyle assessment and then put that information together, and then we determine if it's time or not time. So sometimes we send them away and say, we'll see you in 6 months or we'll see you in a year. Let's recheck and see how things are progressing.
Right.
Other times they say, I need help now. I know it's 30%, but I can't hear I can't hear my coworkers at a meeting. So we have to figure it out.
So I was thinking, as you were talking about this, that, well, first of all, let me do this. Let me just give some information. So you will call. I'm going to give you one phone number to call, and that's 561-994-4143.
No, you mixed Broward and Palm Beach. Not 561.
We don't want to do that. We want to get. Yeah. Okay,
I'm going. See that one?
Yeah, I'm going to get that back. I don't have it. Yeah, I'm going to do that. While you're talking, I'm going to go back and get that because I didn't have this on this, but I'll get it from your ad. Okay, so let's just keep going. So now let's say somebody, though, isn't in business and they play cards or they play golf. You're saying that maybe they don't need it.
It's not for me to say. It's for me to question them, if you will, and again, a lifestyle assessment and try to bring out what's affecting their life. How can we improve their life? And if they say, I hear about half of what they're saying at the card table, then yes, it is time to do something. We can make them hear everything at the card table. But if they say, I absolutely miss nothing, and their test shows a very mild high-frequency impairment, it may not be impacting them yet. So that's part of it, trying to ascertain what's happening in their everyday life.
And let me give the number now because I do see this. The Boca Raton number is the one that, because you have both of them in the app, but let's do that. 561-221-0450.
That's it. That's right? For Boynton Beach and
Boca
Raton.
But even if you live in Coral Springs, where you have that was really your first office down in Coral Springs, but they'll give the number and they'll make the appointment and everything, right?
Actually, correct. We have one central location where the phone calls are answered. So regardless of the phone, you'll probably hear Samantha, which I think you met Samantha.
Yes, I did. Anita, that's the nice part about what you have. It's a very friendly situation. Even if, you're a little scared, you go there and a lot of these people are your families and it's just something that you've created. So it's more than just going and getting your hearing tested. You have a friend there. They're so sweet. They're so wonderful. And it's your passion that everyone's feeling. I noticed that here you are. You just came in late last night from this course that you took. And now you're here early in the morning with a big smile. Yeah. That's something really special about you. But let me give the phone number. 561-221-0450. Get your pencils out. It's Pencil Talk Radio. 561-221-0450. And what are you going to do with that phone number? Make a phone call and get a free hearing test. That's the interesting thing, too, that you do. It's still free to have a hearing test, and it takes you probably a good 30 minutes just for the test, doesn't it?
Correct. Right.
Amazing that you do this. But,
correct.
And usually people are going to come with some little complaints or when you were talking, I just want to ask you a question. Wait, I want to go back. You have a website, too. I just want to go to your website also because it's a beautiful website, and I'm having difficulty finding that website.
Well, it's www.activelifehearing.
Oh, it's just activelifehearing.com.
Yeah, if you search that, it'll come
I
right
don't
up.
see this in your ad. If it's not, we got to get it in there. Yeah.
If they search Active Life Hearing, it'll pop up. My husband happens to be a software engineer, so
right. But it's activelifehearing.com.
Yeah.
That's what we want. So, okay, I want to go back to what I was going to ask you. So, in other words, there are people who hear things, but they get it wrong.
Yes.
See, that's a very important thing. Oh, I hear everything. Yeah. Now, but when they hear it, then they don't get the right phone numbers. They don't get the right what we're doing here.
Right.
And so it's kind of like vision in a sense.
Right.
That they're not seeing what's really there, and then they make a mistake. So imagine if someone is now 60 or even 70, they're not reading it correctly, and they're not hearing it correctly. They're going to make a lot of very serious errors.
Absolutely. It's funny. I had my best friend I grew up with. Her husband is an ER physician over in the Tampa area, but he travels a lot now, managing other ER clinics. But I'm surprised. He called me the other day and he said, "You've got to test my hearing." He goes, "I'm going to meetings now with these other physicians," and he goes, "I literally cannot hear what they're saying, and I can't let them know that." So he drove over, he and his wife, and of course, they're friends of ours. So I tested his hearing. I said, "Dan, it's time." So I fit him with hearing aids. He had a meeting in Fort Lauderdale, and then we met that night for dinner. And I said, how did it go? He said, I cannot believe what I'm hearing. He goes, it's unbelievable. So it was cute. Someone that I knew this couple. I was in their wedding. It's going back many, many years. And he's my age. I mean, he's in his late 50s. And, he recognized that to stay at the top of his game and to be able to work in this professional setting, he had to hear everything. And so, awesome.
So the word is a misnomer here. We hear everything, but are we hearing it clearly?
Hearing it clearly and understanding. You got it.
So when people come and say, I hear everything. Yeah. I know. But are you hearing it clearly? And that's why, describe to the test that it's such a simple test, but it's so meaningful. Talk about the test.
It is. It's so simple. We look in the ears and make certain they're clear. Obviously, we want an accurate exam. And then we use insert earphones, which are the state-of-the-art way to test hearing now. They don't go on top of the ear. They go inside because it's more accurate. And they're sitting in a sound-isolated booth. We test all the frequencies that are used for understanding speech. And as we present the tones, they press a button every time they hear it, and we find the very softest point that they can hear all of these sounds. And after that, we do an assessment of speech where we present all of the words, and we use words to present all of the sounds in our language to see if there are any specific sounds that are not being heard and affecting their ability to understand words clearly. So that's called word recognition. And then we check for bone conduction, which identifies whether the hearing loss is coming from the inner ear, which is treated with hearing aids, or possibly the middle ear, which may mean that they could be helped with medicine or surgery. And we wouldn't we wouldn't prescribe medicine or surgery, but we would refer them to someone that would. So we try to determine if it's something we help with hearing aids or something that requires medical intervention. And then we go from there. And then the biggest part of the exam after that is really, if there's hearing loss, trying to, have a huge variety of demonstration hearing aids. We match what's appropriate for them, match a setup for them, and we let them take them home and
go to that. So what is appropriate for one person and not for another?
Well, exactly. We have to look at not only the degree of hearing loss, but dexterity, cosmetic concerns. Do they need Bluetooth functionality? We even have demonstration chargers they can borrow, television adapters. In fact, this one couple, I think, just adopted my daughter because they couldn't figure out how to plug in the Bluetooth television adapter. So you can now convert your TV to Bluetooth and stream it into your hearing aids. So it's like having a wireless headset, but you're actually just sending the signal to the hearing aids. So, it's two little plugs, but not everyone's comfortable looking at the back of the TV. And so my daughter said, I'm going to follow you home. She was working with me that day. She goes, I can set it up. And, so she went there, and now they have a new granddaughter, I think.
I have to say, this is unique. I've been in the hearing aid business years ago, and that just doesn't work this way. You just have created something that is rare. And even if someone else would say, I'm going to do what she does. No. You have to really have the heart and soul that you do.
You have to feel it.
That's what you do.
I've lived this for 30 years, and I'm very passionate about helping people.
And I'll bet everyone who's ever come to you who needed hearing aids, you've never lost them unless they moved away.
That's true. And
I can tell
and
that.
Usually they're referring friends and relatives. And I have one patient, it's so cute. They live in Chicago, but they have a place in Delray, and they're a little bit younger. And he actually said, you are so awesome, blah, 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 and your pricing is so fair and reasonable compared to Chicago. He said, I'm going to have my friends come and stay at my condo when I'm not there so they can come and get hearing aids from you. I said, that's so nice. So, yeah.
Well, that's true because...
And he meant it. They've already called.
See, because hearing aids has really had such a stigma, and you make it where once they're with you, it's like, okay. It's like getting an implant in my mouth or getting, something so new. As you said, get my gray hair, tinted or dyed or whatever we call it now. I am so thrilled that we are working with you because I have dreamt of something like this because I was very much like you. I'm not an audiologist, but I remember I used to stay till 6, 7, 8 o'clock at night taking complaints.
Right.
You know, because people had complaints
Right.
and nobody wanted to hear them, but they didn't know what to do. This isn't casual.
Exactly.
So I'm going to give the phone number again. Please make an appointment. If for no other reason, just go meet MICHANNE Davidson. The phone number is 561-221-0450. 561-221-0450, and on the web is activelifehearing.com. They have beautiful centers. One, of course, is in Boca, one is in Boynton Beach, and one is in Coral Springs. So in the time we have left, just give a quick idea of what unbundled pricing means.
Unbundled means we have the ability to separate some of the office visits from the cost of the hearing aids. And we do this because it allows us to charge a lot less for the hearing aids, which then allows people to obtain better technology within their budget. So as an example, the old model would be, okay, you buy the hearing aids and all your checkups and visits are included for the life of the hearing aids. And in the past, that was a good thing because hearing aids weren't that well made. They would break down constantly and required a lot of follow-up care. It's just not the case anymore. We can actually, within the first couple of months, we can have those hearing aids so well fine-tuned. And then the products themselves are water-resistant, sweat-resistant, wax-resistant, that they just don't require those excessive follow-up visits anymore. So if we separate that out and say, okay, so we'll fit you with the hearing aids. We'll work with you for 90 days for no additional cost. And then after that, pay a small office visit when you need us. It just drastically reduces the cost for people, like up to $2,000 a pair. And that's a big deal when you're looking at the technology available today, because the better technology, the higher end technologies that work better in noise, they cost more. So if I can give more people access to the really good technology, I'm helping more people.
But you see, you're not greedy because a lot of people say, great, now we can make more money.
Correct.
Because we're going to sell it for what people are used to selling it for, the $3,000 or $4,000 or $5,000, whatever, $6,000, whatever it costs to get the very best. But we just won't see them as much, but we're just going to take the money.
Right.
And you decided, because you've seen so many people over the years, that if you can get more people, not so much just coming into you, but hearing better. It's why you do this.
Unbelievably rewarding.
You do this.
Unbelievably rewarding. Like as an example, the gentleman from Chicago, they were $2,500 more a set in the city of Chicago. So he can come down to Florida, and
same hearing aids.
Same hearing aids. And over in Naples, someone was $9,000 for ones that were $4,500.
I can't even
really double.
That's what gives people a bad reputation.
Yeah,
and it's sad. the whole industry. But you have set a very high bar, and I love that, MICHANNE.
I've made some enemies in my field.
Doesn't
because
matter.
I've chosen this path, but it's a path that I'm loving.
Yeah, no, it's wonderful. When I met you, I knew so much about what you were doing before, but now this is just beautiful. So everyone, if you have your Boomer Times, just go to page 5, and it's called High Tech Hearing Care, and it's really important that you do this, that you go there and speak to her. I am so excited about this, and I certainly want to recommend them so highly. Go to their office, go there to meet. Now, this high tech, the thing is there are a lot of people that still have hearing aids, and they're still using them, and they're older hearing aids. And I'll bet if they went to you and brought their older hearing aids, you could show them such a difference in what it is today.
Exactly. It's night and day. And that's really why I love the demonstration program we have, where you can just sign them out like a library book, take them home and try it. No, really, that's
so
all.
funny.
And we're very trusting. We don't Yeah,
you're
take
amazing.
any financial information because
you're amazing.
we get to know our patients' first name basis. Here you go. Borrow these for a week and tell me what you think.
You're like the granddaughter that they always wanted and didn't have,
like
right?
the grandparents that I always wanted. Yeah.
Well,
I lost mine
MICHANNE,
very early.
yeah, I'm just so happy that you're here live in the studio this morning after this big trip. Where was that?
I don't feel so alive this morning.
Well,
Anita.
you're always alive.
It was in New Jersey.
New Jersey. It
Yes.
was cold, too.
It was cold.
Oh,
Yes,
my
it was.
goodness. So anyway.
But we were trapped inside the whole time, but all good.
So I'm so happy. So just look at, go make a phone call to MICHANNE Davidson. And I'll give the phone number again. It's 561-221-0450. Make the call, make the appointment. And wouldn't it be great if you make the appointment and MICHANNE says, you have no hearing loss?
It happens.
You love that?
It happens.
Try it,
I love
right?
it, yeah.
MICHANNE, thank you so much for being with us this morning.
You're welcome, Anita. See you next month.
Okay.
Huh? Okay, bye-bye.